talk about what we've learned over the last couple months here at Accelerated, and really talk about what's happening in Kern County with our testing, what's happening in California with the testing, and kind of an ER physician entrepreneur perspective on what's going on, and kind of what we think the approach should be going forward. And Dr. Masihi and myself have been dealing with this as you have. I'm sure you guys are working from home, you're sheltering in place, you're isolating yourself, and we want to talk about if that still makes sense. So we want to kind of take everything we've learned and throw it against the backdrop of who we are. You know, we both have had extensive classes in microbiology and biochemistry and immunology. We've studied this for each of us 20 years, and we take everything that we're seeing today and we put that against that backdrop and say, does this make sense? Are we following the science? We keep hearing following the science. What is science essentially? It's the study of the natural world through experiment, through observation. So that's what we're doing. We're studying the disease around us. We're making observations. We're doing testing, experiments to figure out exactly what's going on. And so this has caused some severe disruption for Accelerated, as we have people coming in 7 in the morning till midnight. We're reporting to the health department. We're calling patients back. And at the same time, our volumes have dropped significantly. The hospitals, their ICUs are empty, essentially, and they're shutting down floors. They're furloughing patients. They're furloughing doctors. So the health system has been evacuated in certain places. In New York, the health system is working at maximum capacity. In California, we're really at a minimal capacity, getting rid of our doctors and nurses because we just don't have the volume. The hospitals don't, as I've met with their CEOs twice in the last week, and we don't as well. So we're busy with paperwork for COVID, and we're all focusing on COVID. And so one of the things I'd like to talk about is when I talk to ER physicians around the country, what's happening? Well, because COVID has become the focus, people with heart disease, people with cancer, hypertension, and various things that are critical are choosing not to come in based on fear. So what that's doing is causing the health system to focus on COVID and not focus on a myriad of other things that are critical, because we don't have the staff there, and the major component is fear. People are saying, I don't want to go get seen by my doctor. What if I get the COVID? So there is a lot of secondary effects to COVID that aren't being talked about. And so we'd like to kind of look at how we responded as a nation and why we responded. Our first initial response 2 months ago was a little bit of fear. We decided to shut down travel to and from China. These are good ideas when you don't have any facts. We decided to keep people at home and isolate them. Even though everything we've studied about quarantine, typically you quarantine the sick. When someone has measles, you quarantine them. We've never seen where we quarantine the healthy, where you take those without disease and without symptoms and lock them in your home. So some of these things, from what we've studied from immunology and microbiology, aren't really meshing with what we know as people of scientific minds that read this stuff every day. So that's kind of how we started. We don't know what's going on. We see this new virus. How should we respond? So we did that initially. And over the last couple months, we've gained a lot of data. Typically in Kern County, for instance, we've tested 5,213 people, and we have 340 positive COVID cases. Well, that's 6.5% of the population, which would indicate that there is a widespread viral infection, similar to flu. We think it's kind of ubiquitous throughout California. We're going to go over those numbers a little bit to kind of help you see how widespread COVID is and see how we should be responding to it based on its prevalence throughout society, or it's the existence of the cases that we already know about. So if we look at California, these numbers are from yesterday. We have 33,865 COVID cases out of a total of 280,900 total tested. That's 12% of Californians were positive for COVID. So as you guys know, the initial models were woefully inaccurate. They predicted millions of cases of death, not of prevalence or incidence, but death. That is not materializing. what is materializing in the state of California is 12% positives. Well, if we have 39.5 million people. If we just take a basic calculation and extrapolate that out, that equates to about 4.7 million cases throughout the state of California, which means this thing is widespread. That's the good news. We've seen 1,227 deaths in the state of California with a possible incidence or prevalence of 4.7 million. That means you have a 0.03 chance of dying from COVID-19 in the state of California. 0.03 chance of dying from COVID in the state of California. Does that necessitate sheltering in place? Does that necessitate shutting down medical systems? Does that necessitate people being out of work? So that's California, and that's. I also wanted to mention that 96% of people in California who get COVID recover with almost no significant sequelae or no significant continuing medical problems. So those are important statistics for the state of California. 2 months ago, we didn't know this. So I'm going to bring it to light now because we're sharing our own data. This isn't data filtered through someone. This is our own data. We found 6.5%, and then California has found 12%. So the more you test, the more positives you get, the prevalence number goes up, and the death rate stays the same. So it gets smaller and smaller and smaller. And as we move through this data, what I want you to see is millions of cases, small amount of death. Millions of cases, small amount of death. And you will see that in every state. And since we're talking about following the science, we're going to follow the statistics and follow the science. So I want to look at New York State. They've been in the news a lot, right? And their numbers are critical. Let's go over their numbers. Cases of COVID as of yesterday, 256,272 cases in New York State. Not New York City, New York, the entire state. They did a total of 649,325 tests. That's 39% of New Yorkers tested positive for COVID-19. That's their ratios. This is public data online. You can all look it up.
39% of people were tested.
39% of the people were tested.
39% of New York State.
Right.
39% of New York State is there's 20 million people there would be close to 4 million.
Which is likely, they likely have 7.5 million cases.
But I just want to make that clarification. It's
Yeah.
not 39% of every New Yorker, it's every New Yorker who's been tested.
Right, so we extrapolate data.
I just want to make that
We extrapolate data, we test people, and then we extrapolate for the entire community based on the numbers. The initial models were so inaccurate, they're not even...
But in those initial models, a lot of them were based off if we did no social distancing.
Right.
Is that correct? So is it really fair to say, obviously they're not as bad as they were because those were based on alternative scenarios?
And some of them were based on social distancing and still predicted hundreds of thousands of deaths, which has been inaccurate. So in New York, the ones they tested, they found 39% positive. So if that's indicative, and they tested 649,000 people, that's a massive test. That's accurate data, 39%. So if they tested the whole state, would we indeed have 7.5 million cases? We don't know. We will never test the entire state. So we extrapolate out. We use the data we have because it's the most accurate we have versus a predictive model that have been nowhere in the ballpark of accurate. So how many deaths do they have? 19,410 out of 19 million people, which is a 0.1% chance of dying from COVID in the state of New York. And they have a 92% recovery rate. If you are indeed diagnosed with COVID-19, 92% of you will recover. So we're seeing millions of cases, small amount of death. Millions of cases, small amount of death. And the reason I'm making that point is because we're going to compare this to flu and say, is this significantly different from influenza A and B? And if not, why has our response been what it is? USA, this is a big one for us. 802,590 cases as of yesterday. We've tested over 4 million. If you guys have studied globally what's happening, that's double what any other country. Germany's at 2. I realize their populations are lower, but the fact that we were able to ramp up and do 4 million is pretty impressive, which gives us a 19.6% positive out of those who were tested for COVID-19. So if this is a typical extrapolation, 328 million people times 19.6 is 64 million. That's a significant amount of people with COVID. It's similar to the flu. If you study the numbers in 2017 and 2018, we had 50 to 60 million with the flu, and we had a similar death rate. The deaths in the United States were 43,545, similar to the flu of 2017, 2018. We always have between 37 and 60,000 deaths in the United States every single year. No pandemic talk, no shelter in place, no shutting down of businesses, no sending doctors home.
That's from the flu, by the way, just to clarify.
Yeah.
37,000 and 60,000 flu deaths
37
Every year,
60,000.
per the CDC. Due to flu.
Okay.
In the United States. Some years, it's even as low as 20,000 some year. In 2017, 2018, it was 45 to 50,000, depending on who you read. And we don't necessarily report all of our flu tests. We do thousands of flu tests every year. We don't report every one because the flu is ubiquitous. And to that note, we have a flu vaccine. How many people even get the flu vaccine? The flu is dangerous. It kills people. So just because you have a vaccine doesn't mean it's going to be everywhere. And it doesn't mean everyone's going to take it, because we see every year that we have a vaccine, and I would say probably 50% of the public doesn't even want it. So just because you have a vaccine, unless you force it on the public, doesn't mean they're going to take it. I want to compare the U.S. to Spain, because Spain is number 2 in the race for the most cases, which is not a race we want to win. They had 204,178 cases in Spain, 930,000 total tests. So we did 4 million, they did 930,000. They had a 22% of all COVID tests were positive in Spain. 22% of those tested were positive in Spain. Spain has 47 million people. So that equates to about 10 million cases. If we extrapolate the data, as we've been doing with every state, gives us about 10 million cases. How many died in Spain? 21,282 out of 47 million. You have a 0.05 chance of dying from COVID as a citizen of Spain, and a 90% chance of recovery from COVID without being on a vent, without being in a hospital. I wanted to compare the U.S. to Spain because we have the most amount of cases globally. So I thought that was important. And then when you bring up a system of lockdown, you automatically have to compare it to a system of no lockdown. Sweden and Norway. I'm Norwegian.
Norway has lockdown.
Norway has lockdown. Sweden does not have lockdown. What happened in those two countries? Are they vastly different? Did Sweden have a massive outbreak of cases? Did Norway have nothing? Let's look at the numbers. Sweden has 15,322 cases of COVID. They did 74,600 tests, which is 21%, similar to the other countries. 21% of all those tested came up positive for COVID. What's the population of Sweden? About 10.4 million. So if we extrapolate out the data, about 2 million cases of COVID in Sweden. They did a little bit of social distancing. They would wear masks and separate. They went to schools. Stores were open. They were almost about their normal daily life with a little bit of social distancing. They had how many deaths? 1,765. California's had 1,220 with isolation. No isolation, 1,765. We have more people. What I'm getting at is millions of cases, very small death. Millions of cases, very small death. This is what we're seeing everywhere. Norway, its next door neighbor. This is where I come from. These are two Scandinavian nations. We can compare them as they are similar. Let's look at the data. Norway, 7,191 cases of COVID. Total COVID tests, 145,279. So they came up with 4.9% of all COVID tests were positive in Norway. Population of Norway, 5.4 million. So if we extrapolate the data as we've been doing, which is the best we can do at this point, they have about 1.3 million cases. Now their deaths as a total number were 182, fairly small, but statistically insignificant from 1,700, you realize. Millions of cases, small amount of deaths. 1,700, 100, these are statistically insignificant. So you have a 0.003 chance of death as a citizen of Norway and a 97% recovery. Their numbers are a little bit better. Does it necessitate shutdown, loss of jobs, destruction of the oil company, furloughing doctors? That's the question I have for you. And I think the answer is going to be increasingly clear as we move through this data. The next thing I wanted to talk about is the effects of COVID-19, the secondary effects. COVID-19 is one aspect of our health sector. What has it caused to have us be involved in social isolation? What does it cause that we are seeing the community respond to? Child molestation is increasing at a severe rate. We could go over multiple cases of children who have been molested due to angry family members who are intoxicated, who are home, who have no paycheck. These things last a lifetime. This isn't about a seasonal flu. These are things that will follow these people and affect them in a negative fashion for their life. And these are secondary effects from COVID. And these are for me talking to ERs, talking to my doctors, and talking to people across the country and finding out what they're seeing. Spousal abuse. We see people coming in here with black eyes and cuts on their face. It's an obvious abuse case. These are things that will affect them for a lifetime, not for a season. Alcoholism, anxiety, depression, suicide. I talked to Donnie Youngblood and various people in the community, and I've asked them, how are things going? Suicide is spiking. Education has dropped off. Economic collapse. Medical industry, we're all suffering because our staff isn't here and we have no volume. These are all real things that I'm seeing every day. I don't read about this stuff. I'm seeing it in my clinics. We have clinics from Fresno to San Diego, and these things are spiking in our community. These things will affect people for a lifetime, not for a season. So let's make sure we're clear on that. So we've gone over the secondary effects. We've gone over the statistics. Now I want to compare flu virus. Is this significantly different? And I just got a little bit of data here. So deaths, per the CDC, 24,000 to 62,000 deaths each year. We had about 45 million total cases in 2017 with about 62,000 deaths, or a 0.13 chance of death from flu in the United States. As you know, our other numbers were 0.02. So the lethality of COVID-19 is much less. Now, you've got hotbeds of it in New York, but again, we went over the numbers. 0.1% chance of death. Widespread, small amount of deaths. It's similar to flu, as a matter of fact. If we follow the science, as we've been asked to do, I'm following the science. This data is generated by the CDC, World Health Organization. The testing is generated by what we have done here. So we are following the science. Now I want to talk about the immune system. Dr. Masihi used to teach for immunology. We both had years of microbiology, biochemistry, and virology studies. We've made it our life's work to understand this stuff. And here, I'd like to go over some basic things about how the immune system functions so people have a good understanding. The immune system is built by exposure to antigens, viruses, bacteria. When you're a little child crawling on the ground, putting stuff in your mouth, viruses and bacteria come in, you form an antigen-antibody complex, you form IgG, IgM. This is how your immune system is built. You don't take a small child, put them in bubble wrap in a room and say, go have a healthy immune system. This is immunology, microbiology 101. This is not something, this is the basis of what we've known for years. What I'm seeing is when you take human beings and you say, go into your house, clean all your counters, Lysol them down. You're going to kill 99% of viruses and bacteria. Wear a mask. Don't go outside. What does it do to our immune system? Our immune system is used to touching. We share bacteria, staphylococcal, streptococcal bacteria, viruses. We develop an immune response daily to this stuff. When you take that away from me, my immune system drops. As I shelter in place, my immune system drops. You keep me there for months, it drops more. And now I'm at home, hand washing vigorously, washing the counters, worried about things that are indeed what I need to survive. Let's follow the science. This is immunology, folks. This is microbiology. This is what we've combined together. We have 40 years of experience in this. This is common sense immunology.
So quarantining and social distancing is worse for us, you're saying?
It decreases your immune system. You can't build an immune system by, if someone has a reduced immune system, you hide them away because they can't build an immune system. If you have a normal functioning immune system, you need interaction. When a child is in a womb, you're in this protected environment. When you come out, you have almost no immune system. You develop that through touching your mouth, touching your eyes, virus, bacteria, immune response, IgG, IgM. This is how you build a strong immune system.
You think people are worrying too much?
Of course they are, but that's from media telling them to. I am telling them sheltering in place decreases your immune system. And then as we all come out of shelter in place with a lower immune system and start trading viruses and bacteria, what do you think is going to happen? Disease is going to spike. And then you've got disease spike amongst a hospital system with furloughed doctors and nurses. This is not the combination we want to set up for a healthy society. It doesn't make any sense.
So is Dr. Fauci wrong then when he says that COVID-19 is shown to be nearly 10 times deadlier than the flu?
Initially, maybe that was true. But again, I'm going through the numbers. I'm not saying who's wrong or right. I'm going through the science and through the numbers. And I, like you, have been watching media and studying this for 2 months, night and day. I go to bed at 2 or 3 in the morning. Every day I read after my shift, and I say, what's going on here? I'm not in an ivory tower. I'm in seeing patients every day, and I'm collecting my own data. I didn't have data 2 months ago. I just shared my data. 6.5% of all patients we tested are positive. That's actual, unfiltered, non-political data.
So respectfully, to go off that question, and I know you guys are obviously very intelligent, very accomplished physicians, do you think that you guys know more than the top immunologist in the entire United States, and that basically every country in the world has got this wrong, that accelerated urgent care has got this right?
I'm not saying, again, I'm sharing the data. I'm not saying we're right, somebody's
but
wrong.
Your conclusions from that data are different than what the top doctors worldwide are concluding. Why is that? Why is that discrepancy?
The data is coming in.
The World Health Organization and the U.S. government has no data?
No, I'm saying you have to give the virus time. From December to now, there was tons of hypotheses. You have to let the data work. Let the virus rise up. Then we study it and we see, did we respond appropriately? Initially, the response, fine, shut it down. But as the data comes across and we say, now wait a second, we've never, ever responded like this in the history of the country. Why are we doing this now?
And you don't think that they're also studying that data and that their data is even more accurate and more timely than what we're getting here in Kern County?
Yeah. What was your first name?
Tim.
Tim. So I think
Oh, sorry.
Please.
Thank you for your question. I think your question is valid, and obviously Dr. Fauci is a world-renowned immunologist, and a lot of the data that they originally gave us was theoretical, because coronavirus is a new virus. We've studied coronavirus since the 70s. Coronavirus was...
we studied different coronaviruses. This one is novel. Like SARS is a form of coronavirus, MERS is a form of coronavirus.
Sure.
We've studied different types, but this one is new. So with all due respect, again, we haven't studied this virus.
But if you let me finish...
Let me finish.
So every year, according to your argument that you just made, every year...
Not an argument, just a question.
Every year when we get the flu, it's a new flu virus, correct?
Correct.
But 99% of it is flu, correct? The way viruses change, they undergo mutations through their DNA, deoxyribonucleic acid. There are different types of mutations which either cause increased virulence and more likely decreased virulence, meaning how dangerous a virus is. So when coronavirus was, we've been studying coronavirus since the 70s. And this type of coronavirus that came out was first and foremost transmissible through human beings, and that was new. And I think any time you have something new in the medical community, I've been a doctor for 26 years. Anytime you have something new in the community, the medical community, it sparks fear. And I would have done what Dr. Fauci did, so we both would have initially. Because the first thing you do is you want to make sure you limit liability and limit deaths. And I think what they did was brilliant initially. But looking at theories and models, which is what these folks use, is very different than the way the actual virus presents itself throughout communities. And there's different communities we're talking about here. Bakersfield, a lot more widespread than Manhattan. Very, very different. So you can't really... theory and reality are not always the same. And that's what Dr. Erickson is presenting. It's not about being right or wrong. Medicine, what they teach us is you practice medicine. I'm learning every day. So is Dr. Erickson. We all learn every day. It's not about being right, who's wrong. It's not a basketball game, who made the basket, who didn't. It's about looking at trends and saying, hey, we're not seeing what they've been talking about. For the past 6 to 8 weeks, we've crippled the economy. There's a lot of domestic issues going on. Is social isolation warranted for the healthy?
So, again, I understand that you guys are seeing drawing different conclusions from the same data. Why is that? That's my question.
Because we're actually seeing the patients. Dr. Fauci hasn't seen a patient for 20 years. I'm just saying, it's in general, a lot of the figureheads are not, it's like the general contractor versus the sub. He's not seeing patients, he's in an ivory tower. And we have a world of respect for him. He's a world-renowned immunologist. Two different things. He's an academic. We've dealt with academics all of our life. I did surgery at USC and Loma Linda, all academics. But academics and reality is two different things. Two different things. So we're just presenting our data and our opinion as medical professionals in this community.
I was going to say, so you're not necessarily talking about a community in Manhattan, which obviously is much
well, we
more
don't.
dense.
We haven't. I haven't been to Manhattan for 20 years.
Just
right?
that focus.
Yeah.
So let me ask this. So I mean, in your professional expertise, both of you guys very prominent here in the community. Why do you think we are taking these measures? Why do you think that? Governor Gavin Newsom. Why do you think he's taking these measures to have California being on a strict shutdown right now?
Well, again, as a leader, you listen to the people around you, and they make decisions on different timelines. And so Gavin Newsom has people around him telling him, we think this is the best move for now. And then early on, we told people the truth changes every 2 hours, because it was. As the data moves, as we do our own testing, I'm giving a different answer now than I would a month ago, because I understand the progression of disease in this area. I also understand the progression of disease elsewhere because I look at their data. I don't have to live in Manhattan to watch their disease process, to watch how many positives in the community, and to understand how disease is spread. For instance, nobody talks about the fact that coronavirus lives on plastics for 3 days, and we're all sheltering in place. Where'd you get your water bottles from? Costco. Where'd you get that plastic shovel from? Home Depot. Those are fomites and carriers of disease. So you take your family sheltering in a place that you think is safe, and you're taking fomites with disease that they've shown that lasts 3 days. Are you really protecting yourself from COVID? Does that make sense to you? It doesn't make sense to me. And if I swabbed things in your home, I would likely find COVID-19. And so you think you're protected, but you've got fomites coming from, Home Depot and Lowe's. And it's okay for us to be mingling in those situations, but we have to not go to work. It's okay for us to go to Costco, but not to church. Do you see the lack of consistency here? From a microbiological, immunological standpoint, that doesn't make sense. If you're going to isolate people, you need to shut these all down, because that's how the fomites are being transferred. When you go to Del Taco and you get a plastic bag or piece on your burrito from someone not wearing a mask who was just wiping their arm on your thing, do you think you're protected from COVID? When you wear gloves that transfer disease everywhere, those gloves have bacteria all over them. I'm wearing gloves. Not helping you. As your mask that you're wearing for days, you touch the outside of it, COVID, and then touch your mouth. This doesn't make any sense. We wear masks in an acute setting to protect us. We're not wearing masks. Why is that? Because we understand microbiology, we understand immunology, and we want strong immune systems. I don't want to hide in my home, develop a weak immune system, and then come out and get disease. We have both been in the ER through swine flu and through bird flu. Did we shut down for those? Were they much less dangerous than COVID? Is the flu less dangerous than COVID? Let's look at the death rates. No, it's not. They're similar in prevalence and in death rate. So we are saying that our response now that we know the facts, it's time to get back to work. It's time to test people. But again, testing gives you a moment in time. Testing tells you, the nasal swab says positive or negative. The blood vial, the tiger top or the finger stick, gives you IgG, IgM. IgG being the long-term immunoglobulin we look at for immunity. But again, it's a moment in time. And what's interesting to me too is when someone dies in this country right now, They're not talking about the high blood pressure, the diabetes, the stroke. They say, did they die from COVID? We've been to hundreds of autopsies. You don't talk about one thing. You talk about comorbidities. Their vessels were narrowed. Their lungs were a smoker. COVID was part of it. It is not the reason they died, folks. It is one of many reasons. So to be so simplistic to say that's a COVID death because they have COVID, you know how many people die with pneumonia or people that die from flu, with flu I should say, it's not from flu. Their lungs were compromised by COPD. They had a heart attack 2 years ago. They have a weakened body. We aren't pressured to test for flu. But ER doctors now, my friends that I talk to say, it's interesting. When I'm writing up my death report, I'm being pressured to add COVID. Why is that? Why are we being pressured to add COVID to maybe increase the numbers and make it look a little bit worse than it is? I think so. So this is what I'm hearing from physicians I talk to in Wisconsin, New York, and everywhere.
So you think that physicians are being pressured to make the numbers look worse than they are?
They're being pressured to add it to their diagnostic list.
So where is that pressure coming from, in your opinion?
Well, I probably coming from the administration. So their administration is saying,
or the Newsom administration?
It's probably coming from the hospital administration. I didn't ask them specifically, but they said we're being pressured in-house to add COVID to the diagnostic list when we think it has nothing to do with the actual cause of death.
You can't confirm that beyond their work.
The actual cause of death was not COVID, but it's being reported as one of the disease processes and being added to the death list. When they died from COPD, they had COVID. COVID didn't kill them. 25 years of tobacco use killed them.
Yeah, that's actually interesting. So I guess my question right off of that is, I know that right now what we're discussing isn't really anything new. There's people with immune deficiencies who COVID just supplements whatever illness they're dealing with, and that's contributing to their death. So going back to what I think the theme is here is quarantining and social distancing. Is it necessary? So my question is it necessary are you saying it's only necessary for some individuals to be quarantining, but for healthy individuals, it's not?
Yeah, exactly. I mean, why would you quarantine the healthy? If you're young and healthy, why would you quarantine yourself? It doesn't make any sense. You quarantine the ill. And
don't they say that one of the reasons to do that is because so many people are asymptomatic, and then they may take it home and spread it to someone who is immunocompromised.
Sure.
I mean, isn't that part of the reasoning?
25% of patients who have COVID are asymptomatic, which is why we advocate for widespread testing. In order to open the economy, you have to have widespread testing. That's number one, no question about it. But historically, if you look at biblical times, you look at leprosy, Mycobacterium leprae, which is the bacteria that causes it. They isolated the sick. They didn't isolate everybody else. So isolating the healthy just doesn't make sense, in our opinion.